The image that comes to mind is the gif of that children drifting and then, with one
I'm out of
hand.
here.
Yeah.
Yeah.
Try to catch me if you can.
Bye.
Not going to surgery
Wonderful
anymore.
example. Wonderful
Yeah,
example.
that's
Thank
it.
you
I'm
very
out
much
here.
for that.
Welcome to the Healthusiasm Podcast, a panel discussion on trends and innovations in health and self-care. My name is Christophe Jauquet. I'm the author of the Healthusiasm books and a professional keynote speaker on health, business, and technology. Every week, I discuss with a panel of experts the positive changes that are shaping our health and happiness. We have from Scotland, but living near Brighton this week, always living near Brighton actually, medical expert in digital innovation, Dr. Keith Grimes.
Yeah, fit like Ebony.
From Ghent, Belgium, human experience expert Mo Zouina.
Hi there. Living in Ghent, but not always in Ghent.
Living in Ghent, but not always in Ghent. And living in Berlin and originally from Colombia, our innovation expert from digital health startups, Nia Escobar-Kölle.
Hi, everyone. And I also have to say, occasionally in Paris.
Okay, that's a good combination. Good combination. Good to have you. Are we ready for this?
Yeah, absolutely. Let's roll.
Nice. Because we will do it slightly differently. We will be talking about hospital experiences. And instead of bringing one article, the way that we approach it this week is that everyone will bring some healthhusiasms that are related to hospital experiences. So, Keith, tell me, what is the hospital experience or the healthhusiasm and hospital experience that you'd like to share with us?
Yeah, well, this last week or so has been thick with healthhusiasms because it's been Health USA in Las Vegas. And so I've been dealing with a great deal of FOMO as my friends have been out in the sun. And so there's been a lot coming back. But if we're focusing on hospital experience, one that caught my eye was a partnership between Nvidia, the Uber graphics card and processor company, and Deloitte, who've developed AI agents or avatars for use as patient co-pilots and assistants inside hospitals. Now, what they've done here, and there's a video available online for those people who want to see it, is that when patients go into hospital, they're obviously there for hospital care and they'll have information put in place, but they may have a lot of questions to prepare themselves for it, or even when they're on the ward, they may have questions that they want answers for, and the staff may be otherwise busy or engaged. Hospitals are very busy places. And the idea behind this approach is to use the power of generative AI and computer graphics and to put an AI avatar accessible to patients in multiple languages and leveraging the power of generative AI to be able to take complex subjects and simplify them in a friendly interface, allow patients to get the assistance they need, answer the questions they need, and maybe collect the information that would help the staff in a way that's available as and when they require it. And I think anything that helps smooth that experience for people coming into hospital, which despite them being full of people and very busy, can often be a very kind of lonely and isolating experience. I think it's great to see some new technologies in this area coming in.
Yeah, lovely. And I think it's a very important example, but I think you can also do it without the use of AI specifically. And I want to go to Born Rigid. It's a typical example I've been using in my keynotes for 5-6 years now, because they have the same objective. They really want to have a smoother experience. They really want to make sure that patients, when they enter the hospital, that they are well received and that that everything goes really smooth. Well, Born Rigid actually is in Denmark. It is soon to be called Mary Elizabeth Hospital. It's a new children's hospital in Copenhagen that is fully designed with the support of medical care and emotional well-being. So they really want to help people feel better at the hospital. And the exceptional thing is not just the Nordic materials that they are using, the light and green spaces, the Nordic design that we all know. It's also not just the fact that they have play labs and family zones to make it less clinical, more like home, maybe even reducing stress for young patients. But the really cool thing that I always use in my keynotes is that it's been fully designed and created by including children, adolescents, pregnant women, the healthcare staff, to really design the entire hospital. So they had several hundreds of children, parents, medical staff, going through a lot of research exercises. They had panel workshops, they had simulations, they had eye track movement exercises, everything that you can imagine they've used to actually design 100 different patient pathways. And based on those patient pathways, they really want to design a whole new hospital. And it's what they say, because you can actually find it online. It's a 100-page guide that describes everything that they've done and the outcomes of it. And it's really to build a hospital which they call will not be a hospital. Funnily enough, we're in Denmark. It's been funded by Lego. Definitely some part of the research has been funded by Lego, and it's also been funded by the Novo Nordisk Foundation, because they really want to have the best possible pediatric cardiac and fetal therapy surgeries out there. So it really will be an hospital that is not a hospital, purely based on including the insights from different stakeholders. And I think that is how we should be building hospitals, I think. It's one of the examples. If I use it in my keynotes, everybody always comes to me, well, what's the name again? And where can I find it? Because everybody's definitely working in hospitals are super interested in that case. It's a wonderful document. Go check it out. Born Rigged. Nia, what's your health enthusiasm when it comes to hospital experience?
Definitely. And I think I want to talk about hospitals in a slightly different way, from a more sensory experience. We always think of hospitals as the places where we go and get care, we see physicians, we get tests, but also hospitals actually provide sensory experience for all the people that are there. And this goes from the sounds to the smells to the textures when we are actually eating the food, lovely hospital food, to the sides, to also how it feels, the type of sheets that you have, or the robe that you wear, and of course the quality of rest, for example. But today I really want to talk about one very interesting aspect of the sensory experience, and is the fact that basically AI is now training specific models to identify diseases through smell. We know, for example, that there are dogs that have been trained for long periods of time, basically to identify cancer, for example. And these dogs are trained by smelling breath, plasma, urine, and saliva, right? That has been collected by doctors and sent to these organizations and then use it to train the dogs. But what if actually we could train AI the way we're training LM models to really identify disease? So actually, this company called Osmo, which started as a personal project of one of the founders who is an ex-Google employee, basically is now aiming to enhance human health and wellness by developing AI models to process and understand scents. And this can have a wide array of applications, but this can actually go two ways in terms of enhancing the hospital experience of all the associations that people have of how a hospital actually smells like, which is disinfectants, bodily fluids, and so on, all the way to identifying how diseases actually smell and identifying them way before, which we know can be done already from dogs, for example, but not to a full extent. So this is a health enthusiasm of the week for me.
May I just come in on that? It's interesting,
Mm-hmm.
a large part of my medical training, they talk about integrating all the senses. So we were taught a great deal about different smells, and there's very distinct smells associated with different infections, different diseases, different improvement in falling states, and everything like that. But you're talking about like dogs smelling this. I remember I worked on infectious diseases for a while, and the consultant there retained one member of staff, a receptionist. And he explained that she was a brilliant receptionist, number one, but he says she was better than any of the pathology labs at identifying what the causative infection was in a patient by walking past their room, because she'd worked there long enough and seen all the lab results. And as a result of that, she could tell very early exactly what bacteria was causing the infection based on the smell emanating from the single room that they were in as well. So it's not just dogs. And yeah, it's a fascinating thing. And the trouble is that we can't have that one receptionist everywhere, of course. So using technology and dogs and whatever other technology would help. But yeah, fascinating stuff.
Definitely, indeed. And I love the example that you gave, Nia, about the smell of food. One of the things I always use in my keynotes when I'm talking to hospitals is, well, I don't use it as much anymore, but I before I went on stage, I always looked on Twitter and looked at hashtag hospital foods. And then I took the last picture that I saw, like the most recent one, and put it onto a slide just before going on stage, because you can have a really wonderful time laughing. I mean, when looking at hashtag hospital food on Twitter, when Twitter was still a thing, of course. But I'll stay with foods. I'll go to Geisinger. You heard of the fresh food pharmacy? Anybody? Fresh food pharmacy is a wonderful example Geet has, because what they've built is they actually built a retail store, if you will, in the hospital, next to the hospital, where they are providing free, nutritious, diabetes appropriate food to patients. And it's basically because there's a lot of diabetic patients, definitely in the States, and they get a lot of advice from physicians. But by the time they left the hospital and they needed to go to a store, they might have forgotten a lot of things. They might have forgotten the paper where it was written on, or maybe they don't remember the website anymore. And so here, you don't need to leave the hospital. You immediately go to that fresh food pharmacy and you get the right foods delivered to you, actually for free, even if you have a certain reimbursement, of course. But the program also offers medical, dietary, social, and environmental services, which includes even group classes on diabetes management, but also some health coaching and so forth. And it's really nice. And the problem that they're trying to solve is, of course, the food insecurity that comes along with diabetes. Of course, a lot of people are not quite sure what they can eat, what is reliable, etc. And so here immediately you get the right information. I think the program started in 2013 already. I think the purpose was to scale it. I have not seen a lot of hospitals do exactly the same thing. Only in Chicago, there's something which is called Just Roots, which does a bit of the same, but it's not linked to a hospital. They also call it the fresh food pharmacy, but it's not linked to a hospital. And there's also very little education or training on dietary and nutritional information, for example. But it is a lovely example, if you ask me, of how hospitals can go about.
Yeah, I could add some extra flavor to this, if you will. I was lucky enough to work with Andrea Feinberg when I was working at Babylon, and Andrea Feinberg actually started up this program as well. And so she was able to share more information about it, and exactly everything that you said there, Christophe, about the great, tremendous success of this for all the different reasons, not just appropriate nutrition, but dealing with deprivation, dealing with the social aspects, dealing with the pleasure of eating good food, fresh food, reducing ultra-high processed foods. All of these things contributing not just in the diabetic population, but also for humans in general. And it is interesting what you're saying about the difficulty of scaling this, because there's this odd disjunct is like within medicine, the idea is that, it's just food. Let's look at some proper medicine instead. Yet the food is the most fundamental part. And I remember Andrea worked very hard to try and get what we were doing at Babylon to incorporate this a little bit more, and didn't really succeed there as well, potentially in part because of this sort of prejudice against something as simple and available to everyone as good diet to affect disease outcomes.
Lovely. Yeah, I love that example. And indeed, I would love to see it a little bit more, but maybe some retailers could pick up the slack of hospitals, or maybe they should collaborate together with hospitals. Mo, tell me your enthusiasm. Well, what can we see in hospital experience?
I love what I've just heard, because it's such a breath of fresh air going to things that are not technology driven. And I think I'm in very fortunate company. But if you look online and you just Google hospital, the future of hospital experience, it's always, I think 99%, it's about technology, AI in the future. But I'm very critical of that, extremely critical, because I think we are overlooking something. We're always looking forward. And that, ladies and gentlemen, reminds me of that film Bird Box, with Sandra Bullock, where it looks like the only way for the industry to survive is by moving forward with a blindfold on and pretending something didn't exist. But it looks like all these firms and technology firms try to survive by ignoring the issues of today and the lessons we haven't learned from the past. So this healthhusiasm for me is a shout out to three themes. The first, what are the lessons we did not learn or correct in the current hospital system that we dramatically need to solve? What is the systemic engineering of that system that we need to address before we can move on? And that is creating a healthy soil for all these innovations to build on. It looks like we're kind of piling innovation on a kind of an unhealthy soil or an unhealthy system. And it makes it almost nonsensical or inefficient. I'm talking about the business model, the delivery model, the funding, calendar-based interventions versus outcome-based interventions. There is a route there to sanitize before giving all these technology solutions. And then secondly, have we explored all the low-tech, high-value, high outcome solutions that are easy to scale, that do not cost any money? I'm sorry for the industry, that do not generate revenue, for any companies. And have we explored and exhausted all possible low-tech solutions that build on the system today, which most probably bring more value and scale to the system than any tech-based innovation could? Let me give you a concrete example. Building more time into patients' visits. Studies have shown that 80% of diagnoses can be made just based on the patient's story alone. So making time for them to open up to clinicians and share their story is a highly valuable opportunity. It's a low-tech one. Group appointments, telephonic care, video-assisted combination, education, and so on. And then the last one, for instance, is I experienced it myself in the clinic. Nia, I'm working, I'm building a regenerative clinic, and there is a clinic where we use no medication, almost no hardware, and we just leverage the people's own regenerative capacity out of blood platelets, stem cells, or adipose tissue. It doesn't generate any business for companies for revenue, but the problem is we don't see our patients back because they really helped, you know. So that is also a shout out to low tech innovation with high value that is easy to implement. So the first is, can we make the soil healthier on which we build innovation? Second, is there an opportunity for low tech innovation to be scaled? And then lastly, and that's the elephant in the room, no innovation talks about making the work for the caregivers easier, healthier, more pleasurable, and more sexy.
Lovely.
So the question is, how can I think of innovation without looking at the human factor? Because how are we going to transition into those future models without people doing what they're doing better today? So I have a good example of that. My father-in-law, unfortunately, is in an elderly center, and I've seen the level of people in terms of education, but also of language, just go down because there's an incredible scarcity of people being there for care. And we see that it's very hard for us to converse with these people because often they do not even speak our language because it's the only one that are willing to work in that industry. So we are looking at these elderly centers being exploited or managed by investment companies. And of course, it needs to be profitable, but it doesn't have to be all about profit, right? So we've never seen as many people drop out of healthcare. We've never seen so many people call in sick. We've never seen such low enrollment rates. We've never experienced people taking retirement earlier. So yes, three things. First, can we make the soil healthier to build the innovation on? Second, can we scale low tech? And third, can we make healthcare sexy again for the people delivering it? So yes, I love the topic, but I think that if we do a what if to the future, we owe it to ourselves to do a what if to the present, but most importantly, a what if to the past.
Keith, you wanted to jump in on that?
Yeah, it's thinking about the hospital experience. There's one thing that I want to share with people that originated, maybe it didn't originate in the UK, but I was certainly aware of it here, was something called Hello, My Name Is. And it did actually impact
Eminem.
around the world. Well, not the song, but in this case, it was a doctor called Kate Granger. In 2013, Kate Granger was sadly diagnosed with cancer. And she's since passed away, but her experience of care was that people were coming in to see her and not looking at her and not introducing themselves. And she thought, maybe we should start with the most basic piece of information. Why don't we just start by saying your name? And not just your name, your first name. Now, that may seem like utterly crazy that we have to raise that, yet I reflect on my own practice. And yes, many times I wouldn't even introduce myself, or if I'd be very, very sort of full name. And so she started a campaign that was hugely impactful in the UK, where you'd wear a badge and the badge simply said, hello, my name is Keith, you know? And there were 4 values that she espoused. Communication, just communicating with the person in front of you in a timely way, starting with an introduction. The little things matter was the next one. And that could be as simple as when you speak to a patient at the bedside, sit down next to them, don't stand over them. Putting a patient at the heart of every decision. No decision about me without me was the mantra. Time and time again. And that translated into little actions like what people wanted at the end of the bed and everything like that. And then the last one was see me as a person and not a disease. Yeah. And those 4 things timeless, essentially. In a time with no technology, you could be using these completely forgotten. Mo, exactly what you said. Let's look to the past and see that. And this speaks to making the soil fertile because people are feeling happier, low tech innovation, and then just making people feel more human again.
Yeah, and I think there's a wonderful hospital that does it. It's a Waldkliniken in Eisenberg, and they on their website they say we consider our patients as our guests, and so they really try to have all of those four elements in everything that they're doing, and they look at the hospital as a hotel. I know many hospitals say so, but they are really trying to do it, and they have 4 and 5 star rooms, comfort, etc., luxury, approach, if you will, sometimes.
Yeah, but I've worked in I've set up a medical center in Spain, and we were also talking about the sheets and things like that. But if the core isn't there, you can do all the decoration you want.
Agree.
And an interesting conversation with our clinical lead of the clinic, Relief Clinic. I had a conversation yesterday, and we decided yesterday to extend her consultation time. So we decided yesterday that the first intake would always be half an hour, 3/4 of an hour.
Lovely. I think thank you for all these health enthusiasms. I still have a couple of unusual ones, as per usual, of course. And I'll go to Nia first. What is the world record for the shortest time needed to build a hospital? If you don't know, you can make a guess.
2 weeks. We saw this in China during the pandemic.
Exactly. It was even 10 days. It was even 10 days. And so what they did is they, it was in early 22 indeed. And let me try to pronounce this correctly. Hoshanshan. And it was in Hoshanshan Hospital in Wuhan. And they just it just took 10 days to actually build it. And it's a 34,000 square meter hospital with a capacity over 1,000 beds. So it's not your random small hospital, let's say. And it really included 7,000 workers, hundreds of pieces of machinery, and everything was pre-made. And it took only 10 days to do it. And it was not the first time, actually, the actual world record, but it was a smaller hospital. It was a hospital in, here we go again, Xiaotangshan Hospital that was built during the SARS outbreak in 2003. It only took 7 days. So that is actually the world record, but it was a smaller hospital, obviously, because SARS was not as impactful as COVID in 2020. But that was the world record that we've noticed in China. Going to another.
I Say
it again.
I just wanted to add. I always ask myself, for how long did this hospital actually run for? What's the viability and lifespan of a hospital when it's built in such a short period of time? But that's another discussion.
Yeah, I fully agree with that. Yeah, I fully agree. And I haven't heard anything about that hospital ever again. It was a big thing during COVID, but I'm not sure where it is right now and whether it was sustainable and so forth. Totally true. Let me see what I go next to. Maybe. Oh, no, I'll first go to Keith maybe. And I know you know the answer, but what can you tell me about a virtual hospital that is run 100% by virtual medical agents?
Yes. Oh, I do know a little bit about this, but so I won't make a wild guess on this, but if I can, maybe I'll check my memory of it as well. This came from a paper that was brought out. Exactly. If I remember rightly, I think it was earlier on this year, and when people were very excited about the idea of agentic AI, little AI agents operating under instruction and interacting with each other. And some researchers built a virtual hospital, or rather what they did is they sort of built a virtual hospital that was dealing with respiratory diseases, populated by little virtual AI agents that were either patients or doctors and nurses and staff. And they used this as a sort of simulation to see whether these models could handle the experience of being a patient or a doctor and what they would learn in the process. And what they found is that modeling a small number of respiratory diseases, but also simulating the access to the different lab results and everything like that, the model performed remarkably well. And the performance of the healthcare agents within this as well improved over the period of time that they ran as well. And that was seen as a very interesting potential way in which we could take AI and fine-tune it to be helpful as an assistant in different areas. They weren't proposing that we replaced the patients and the doctors just with digital representations, but it might be a way in which we could simulate these environments. And yeah, so I think I'm reasonably close on that, but I might have got a few of the details wrong. What do you reckon, Christophe?
No, I think you did it better than I would have expected. But indeed, and just to be clear for all listeners, this is a virtual hospital and there is no human being involved in it. So there's all AI agents who interact with each other. And the medical agents, they were trained with a basic knowledge of healthcare. And as Dr. Keith said, they learned by doing. And that is basically what is the most important thing is that what we've noticed is that these AI agents learned really quickly because they saw in a couple of days, they saw 10,000 patients. Obviously, it's AI driven, so it goes really, really fast. And they achieved a 93% of accuracy in diagnosing respiratory diseases, as exactly you say. You even remembered the therapeutic area. Pretty remarkable, Keith. So yeah, and it could be used in building future hospital experiences, right? Because you can see what works best. Because normally the AI agents should be able to tell you what the best experience should be.
The other thing that occurred briefly on this is that the idea of digital twins, and that comes up time and time again, that you get a kind of close simulated model of a person or a disease or whatever it is. Potentially from this, we might get to a point where a person being admitted to hospital has a number of digital twins spun up, and then therapeutic choices can then be run through the simulation to help identify whether a therapeutic choice might actually be the right one or not as well. And so I know a lot of work goes into that area, but that sort of counterfactual simulation may have a part to play. I still want a nice human experience when I go to hospital, but it doesn't necessarily have to sit on the front end.
Yeah, totally true. Exciting things ahead. Last one for you, Mo. How did Rolls-Royce improve the patient experience at the Children's Hospital of St. Richard's?
How did Rolls-Royce improve the patient experience for the Children's Hospital? I think they gave them... I think they're very good at creating quiet spaces.
It would be a good idea. Be a good idea. Stick to their core business.
Yeah, their core business, cars, luxury. I think they just took them on a ride in a Rolls.
Yeah, something like it. Actually, they created a small handcrafted car called SRH, whatever, and it's specifically for kids. And it looks like an old-timer car. And the cool thing about it is that kids can drive themselves to the operating room. That was the experience. So the cool is that, surgery can be very tricky and scary for children. And so this car helps them to distract and relax them before they go into the operating room. It drives at 10 miles per hour, has a battery in it, etc. And yeah, it's pretty fast for in a hospital at 15, 16 kilometers an hour. So with a child from a very young age. So that was the experience that they created for children in one particular hospital. By the way, that hospital is next to the company itself. So that's why they did it. So.
The image that comes to mind is the gif of that children drifting and then, with one
I'm out of here.
Yeah.
Try to catch me if you can.
Bye.
Wonderful
example. Wonderful example. Thank you very much for that.
Yeah, thank you for all your health enthusiasms. It is a health enthusiasm world indeed. So many positive changes are making our world a little healthier and happier every day. Time to wrap up the Health Enthusiasm podcast for this week. Thank you for listening. If you like this show, don't forget to hit the subscribe button on your favorite podcast platform. I said it well this week. You can also visit healthenthusiasm.com to discover the other episodes, subscribe to the newsletter, and learn more about our panelists. For now, I'd like to thank our panelists for their health enthusiasm. Thank you, Aline Noizet, Dr. Keith Grimes, and of course, Nia Escobar-Kölle. My name is Christophe Jauquet. We are the Health Enthusiasm panel and would love to see you again next week for some more health enthusiasm. Ciao.